Hi, this is Dr. Goodman again. Today we're going to go ahead and talk about some myths and facts about chiropractic care. There's a lot of things that circulate around the internet. There's a lot of things that circulate in neighborhoods, among friends, that may or may not be correct, and I wanted to set the record straight. I'll usually explain to people that there's two things that go on when we're adjusting you. One is you're going to get that popping, that cracking sound. Chiropractors don't generally like using the word crack because it doesn't have a great, it sounds like you broke something. But we'll usually say adjust or pop sometimes. But you get that sound, and that's the first thing that happens. That's usually just incidental. It's not the goal. It's not what we're trying to achieve. If you don't hear the pop, you don't hear the cracking sound, it doesn't necessarily mean that that it didn't move. The second thing that happens is that there's a specific movement we're trying to accomplish in a specific joint, in a specific direction. And so if I'm trying to get a certain movement, sometimes I'll get that movement, it'll kind of shift, but it doesn't pop. And so some people some patients might say, dang it didn't move. And I'll think, well, it moved, it just didn't pop. So, but then in the end, they'll still feel a lot better afterwards, and they get the result they're looking for. But either way, when with chiropractic adjustments, they have studies that show that patients, for certain things, for a lot of things, oftentimes get the same result with chiropractic care, if not better, than a lot of other types of treatment. And so it's worked out really well for chiropractors.
Some people say once you start chiropractic care, you're stuck going forever. Is that true?
This is also another question that we have had a lot of people ask me. Chiropractic care is just like anything. Once your back is moving better, once things are going better, it doesn't necessarily mean that you have to keep going after that. But chiropractic care is also a little bit like exercise or brushing your teeth or whatever it might be. If you want to take care of it, if you want to keep taking care of it, you want to keep working on it. And so a lot of people will choose to continue to go to a chiropractor because it helps them feel better, because it helps them function better. They sleep better, they injure themselves less, and so they feel like those adjustments, those regular adjustments, have helped them do better. And so whether you decide to maintain things or not is really up to the person. In any profession, there's going to be studies. There's going to be times where you'll see damage or somebody who's been hurt. Chiropractic is unique because of the studies that are done. Generally, there is a whole lot less injury and a whole lot less, especially permanent injury, to a person's spine or to a person after a chiropractic adjustment than a lot of other types of things, including the medical profession. So when people ask me that, I'll usually tell people there's certain red flags that we look for, and there's certain procedures that we want to do to make sure that somebody's not going to be injured. We want to follow those procedures in order to allow for people to have any kind of minimal reaction. I think one of the most common things is that first adjustment. A lot of people will come in, they'll get an adjustment, and I'll usually tell them, listen, this first adjustment is a little bit like going to the gym the first time. You're going to come home kind of sore, and so allow that to happen. Give that some space so that your body can start responding and reacting to the adjustment. And usually on the second visit or third visit, it gradually gets better and better and better, and you don't generally have any problems beyond that. Sometimes people will really tight one day. They'll come in, we'll try to get a little bit of movement. Maybe it's a little bit sore after that. But there's generally not any permanent or any more serious type of injury that come from chiropractic adjustments.
Some people argue that chiropractic care only helps with back pain and not other issues. What do you think about that?
We do get a lot of patients that come in to my office, at least initially, because of back pain. It's probably one of the more common things that people come to chiropractors for, but it's probably one of the lesser of the benefits of chiropractic care. We focus on the symptoms, but all the other things that go on with chiropractic care are oftentimes not talked about. Oftentimes, including me, I don't oftentimes talk about it because it's easier just to talk about neck pain or back pain. But they've done so many studies on chiropractic care with the nervous system and the spinal cord and its ability to be affected when you get adjusted. When you get adjusted, they've done studies that shows an increased nerve flow. Oftentimes, the reason we call the subluxation or the alignment problem an alignment problem is because one of the things that's happening is it's not allowing for proper nerve flow. So when you do the adjustment, and they've done the studies on that, you restore that nerve flow. And if you're decreasing nerve flow to anywhere in the body, you're not going to get proper function. And so chiropractors, when you get an adjustment, are also helping the body generally and even specifically whatever area is affected. So you're going to be you're going to feel better. Your neck's going to feel better. Your back's going to feel better. Maybe you have headaches. That will feel better. That's only the tip of the iceberg. There's so many other ways that your body can respond and do better with the adjustments.
If you're not in pain, you don't need a chiropractor.
And that's why a lot of people don't go see chiropractors, is because they don't realize what the benefits are for seeing a chiropractor. I will refer a lot of patients that will come in. I'll tell them it's a little bit like a cavity. You don't feel the cavity, but you go into the dentist to make sure you don't have any cavities. And sometimes they find them, and they'll fix them. They'll fill them. With chiropractic, you don't always feel the back pain. It might be a little inflamed. You might have a little bit of a restriction, but you don't realize. It's hard to realize that that's an injury forming, and those are the things that chiropractors will adjust. That's what we want to correct, so that your body doesn't get worse and worse and worse and start creating more chronic things.
Some people are asking if chiropractic care can replace back surgeries. What are your thoughts on that?
So generally, your medical doctor is not going to recommend, or your surgeon isn't going to recommend back surgery unless you absolutely need it. They're going to encourage you to do what you can to avoid it, because nobody wants to get a back surgery. And so chiropractors aren't necessarily replacing or substitute for back surgeries. But a lot of people, when they get back pain, might think they're going to have back surgery. And then when they start going to a chiropractor, they end up feeling better and better and better. And it ended up not being something that was bad enough to put them into surgery. There are a lot of cases as well where chiropractors can kind of treat your back. We work on your spine, the disc, and can help it heal a lot quicker and avoid it from getting worse and worse into something that would be a surgery. And so, in a way, we can help you prevent back surgeries. But if your back is that bad, we're not likely we're going to be able to fix that. So hopefully this has answered your questions about some of the myths about chiropractic care, some of the questions you may have had with chiropractic care. If you are wondering if you would benefit from getting an adjustment, call us. You'll be able to find our phone number at the bottom, and we'll be able to help you out. Otherwise, if you know somebody that has any of these questions, please share that with them. Also, like and subscribe, and we'll see you next time.